From San Francisco is Dr. Peter Chin Hung, our infectious disease specialist. Thank you so much, doctor, for being on the show on a Friday evening. We appreciate it.
My pleasure, Daytona. I mean, after the Giants' loss yesterday, what else can I do on Friday?
Yeah, you're just sulking at home, eating the ice cream, throwing your Dodgers gear in the fire, I'm sure. Well, thank you so much. I'm happy that you had some time to join us today because I have a lot of questions for you. I sent out via my social media asking people to send in because there's still questions surrounding this. Every time we talk, there's new developments. There were new developments this week with the FDA panel. I want to get to that in a second here, but we're going to touch on all those questions everyone has sent in. So let's go ahead and talk about the FDA panel who has said that they are endorsing the J&J booster vaccine. Isn't that right?
Yes, they're endorsing the J&J booster, but it's endorsed in a very different way from Pfizer and Moderna. Pfizer and Moderna, 6 months for certain groups at risk, older than 65, and those over 18, which jobs put them at risk for continued exposure. J&J, pretty much everybody who got a J&J before can get an additional shot. Now, most people thought of this as it should have been a 2-shot deal from the beginning. So in some senses, it's almost like catching up.
Yeah, I was going to say that because there was a little pushback from some of the panel members saying, this from the beginning, the J&J shot didn't have as high of efficacy as the Moderna and the Pfizer shots. So, should it have been a 2-shot vaccine from the very beginning? What are your thoughts on that?
Well, I think it's easy to say in hindsight, but when you look at similar vaccines like AstraZeneca, they're always 2 shots. And certainly we always felt a little bit, concerned about the data showing that J&J didn't perform quite as well for infection prevention, but it performed very, very well for prevention of hospitalizations and deaths. But nevertheless, it was always quite number 3. And I think this is a chance to think about, giving additional protection to those. In the beginning, J&J was thought of as, as a outreach vaccine. There's 1-shot deal. You don't have to make a second appointment. Doesn't need to be stored quite as in very cold temperatures.
Yeah, this one was for maybe the people who are not fans of the big needles and wanted to get it over with 1 shot. So I'm curious, for all the J&J people out there, should they be concerned about the efficacy of their vaccine if they only have 1 shot?
I still think that it performs very, very well against serious disease, hospitalizations, and deaths. But I guess the question is, how long can it withstand that pressure? We do have evidence that J&J actually performs very stably over time, as opposed to Pfizer and Moderna that wane a little bit over time. So that should give some reassurance to the 1-shot J&J folks. I guess another question is, instead of getting the 2nd shot as J&J, what's emerging now is whether or not people should just go ahead and get an mRNA shot like a Pfizer or Moderna as your 2nd shot.
Yeah, mixing and matching has definitely been in the headlines recently because you have some people who maybe did get the J&J who are like, can I get the Pfizer one? Can I get the Moderna one? From your research, what are you guys seeing at the labs as far as mixing and matching vaccines?
Well, we had evidence from the beginning of this year that in the UK, because they were forced to mix and match, they wanted to vaccinate as many people as possible. When they looked at that data, it actually looks pretty safe and also very effective. And now with the NIH showing a pretty small study of about 9 groups of 50 people each, they mixed and matched and also gave people the same vaccines as a 2nd shot or booster. And if you got a J&J and you got Moderna after, you had like 76 times higher antibodies. If you got a J&J and you got a Pfizer, you had about 36 times higher antibodies. If you got a J&J and you got a J&J as your 2nd shot, you had about 4 times higher antibodies. Of course, these are not clinical data, but I think everyone's kind of looking at this data and deciding, maybe I should get an mRNA shot as my second shot if I got J&J originally. And in San Francisco, for many months now, the Department of Public Health has said, if you got a J&J shot, we'll allow you to go and get mRNA shot as a second, because we know that a lot of people were anxious.
Yeah, so I do want to hop into some of these questions that I was asked online, and I had a woman reach out to me. She said that she's 48 years old. She said, when can I get my booster shot? What's your answer to that?
Well, right now, under guidance, for people under 65, if your job puts you at risk for continued exposure, and that's a very liberal term. I mean, it could be an essential worker, it could be a healthcare worker. And the second group, under 65, who by guidance could go and get a shot, are those who have any medical condition that puts them at risk for COVID. And again, that's very, very broad.
Right. And of course, those things are constantly changing, especially with demand, supply and demand that we have. Going into my next question, which was asked several different times, and I think there's a lot of people out there who are questioning this. Especially with the vaccines, we're hearing more about them, fading out a little bit after a certain amount of time period, which we'll get to that because there were questions on that as well. But what are your thoughts on natural immunity versus immunity with the vaccines?
So first of all, natural immunity is definitely a thing. It can definitely protect people. We've seen that in communities, even before the vaccine, when you get hit hard, like in India, it kind of goes away and you kind of get a go free pass for a few months. Studies show that maybe as up to a year or more, these antibodies can last. The problem is we don't really know who's going to be in that promised land and who's not going to be. We think most people will be, but there isn't any way to predict that because there's a wide range of symptoms that people can get in natural infection. Therefore, when you look at studies, one study actually showed a 1,000-fold difference in antibodies from natural infection. The bottom line is it could probably count as a shot, but I would probably be most
doctor
vaccine rather than
you broke up for
natural
just a second right there. So if you could just repeat what you just said.
What I said was that the bottom line is natural immunity definitely counts, but not by itself. So I probably think about natural immunity as mixing and matching with a vaccine and maybe thinking of it as one dose.
Okay. So one dose right now, and if you were to compare it to a vaccine, would you say a vaccine is a better source of immunity than natural immunity, or are you saying there's still more research to be done on it?
No, I still think that the vaccine is better. Not that people who get natural infection don't have the same level of antibodies, but it's very variable in the people who get natural infection, how many antibodies you'll get, if at all, because people have different symptoms. The way I think about natural immunity is you can think of it as a booster. So if you get like 2 shots and you got naturally infected, you're kind of set to go.
Okay, interesting. And then going off of that, stepping back into the vaccines, possibly waning a little bit, is there a timeline on that? I'm seeing a lot of these studies are saying within 4 months, they're seeing a major waning of Pfizer and Moderna. What have you been hearing?
Yeah, so that's a great question because when people think about waning of immunity, it's usually after that first set of vaccines in the first month. Now, remember, when you look at other vaccines like MMR and hepatitis B and human papillomavirus, you usually get a couple in the first month, and then you get one 6 months later. So one is called priming, which is like within the month, and then one is called boosting, which is after a few months. So if you look at the waning after the priming phase, that's kind of when you see the dip. But at least in these other vaccines, the third vaccine kind of carries you out for many, many years. We don't know for sure what will happen with COVID vaccines. but we're hoping that a third shot will last much more than the first 2 shots in terms of 4 to 6 months.
And so with the FDA panel, what are they testing? Are they testing that long-term immunity, or how are they able to endorse this and say that it is going to be effective to get the booster shots?
Well, they're looking at data from Israel, and the Israeli data isn't very, it hasn't followed people for a very long time. But within a month anyway, it seems that the additional booster prevents hospitalizations in older people and prevents infections compared to people who didn't get the booster. So we're just going on precedent from other vaccines, as well as a signal in older folks where the most serious outcomes seem to be affected, which is hospitalizations and death. So that third shot is meant to be insurance against that. You know, we'll continue to follow people over time. We don't have 6 months since many boosting programs started, which is around July in Israel. But my hunch is that it will last much longer than 6 months, unless we get a scary variant that's resistant, which I don't think will happen.
Right, because we know the Delta variant definitely threw a wrench into things and changed up our views on a lot of what is going on with the virus. Going into the next question here, some people said it feels like cases are going down, hospitalizations are going down. You know, is that true from what you have seen in ICUs and hospitals?
Yes, totally. Cases are going down in the US, hospitalizations are going down, deaths are even declining. But it's a very regional phenomenon. I would say most of the US is going down now, but there are still regional pockets like Alaska and Minnesota. But, you know, what's really important to know is that the level at which we are right now is still much higher than a few months ago. We're coming down the mountain, but we are all not on the way to the warming hut yet. We're kind of at the kiddie slope level.
And I know there's a lot of questions right now about kids, because still they haven't been fully authorized to go ahead and get the vaccine. We're kind of getting into that a little bit more. You know, what are you telling parents that you're interacting with and talking to about these vaccines? I'm sure you get asked a lot of questions.
Yeah, so the kid trial, at least in Pfizer, is really promising. They looked at over 2,000 kids aged 5 to 11 in this particular trial. They compared it to individuals aged 16 to 25. And what they found was that you can get very similar antibody levels, but at 1/3 the dose. And interestingly, these kids in the trial seem to have fewer side effects than the 16 to 25-year-olds because they're getting a lower dose. So lower incidence of fevers and lower incidence of chills. Most times when we look at vaccines in the history of kids, bad stuff happens in the first 2 months usually, and so far so good. We've had more than 6 months of data. You know, there hasn't been any signal of untoward side effects in kids. We are not seeing anything abnormal. So right now, I think people feel very comfortable, particularly with the fact that you're giving 1/3 the dose.
I'm happy that you talked side effects, because that brings us into a next question. Some people asking, are there any new side effects that you have been seeing with patients with these new vaccines and booster shots as well that we should be aware of?
I haven't really been seeing too many new side effects that have been so notable on a population level. Individually, patients have complained of things like cluster headaches that are really rare, but I do believe that they happen. Anything that causes inflammation. But in these cases, pretty much everybody's side effect has gone away after vaccine. Of course, there's side effects from getting COVID, and they may not go away for many months. But in my experience, most of the side effects, even myocarditis and pericarditis, inflammation of the heart, that affects young adults with mRNA vaccines, first of all, very rare, 12 per million, and they tend to go away. I haven't heard of anybody who's actually died from it. Most of the young adults have recovered uneventfully.
Right. Yeah, because there's a lot of information that's swirling around on the internet. We like to keep it factual here and ask the experts. And I like to ask you, because I know that you're seeing these patients and you're learning more about this on a daily basis. You know, people are concerned about the possibility of side effects and deaths when it comes to the vaccines. And what is your response to that?
Well, first of all, my response is empathic. I never dismiss someone. I listen to them. I try to understand what is going on, and I have a conversation over time. And you know, I tend to use a combination of data, which is like, you know, is this really more likely to be seen in a vaccinated group versus unvaccinated? Again, when you talk about millions of people getting vaccines, people get other things as well, and if they get them close to the time of the vaccine, it's sometimes hard to disentangle that side effect. That's why we want to look at data. So first of all, non-judgmental. Secondly, curiosity. And then third, a longitudinal relationship. It's really impossible to really dispense with somebody's concerns in the one visit, but over time, hopefully, and with many people get more comfortable with it. I think particularly if they talk to friends and colleagues who've gotten it themselves, that's also been powerful. But the most important thing is really listening to people and being empathic to what they've experienced.
Right. Last question for you. Doctor, thank you so much again for being with us here on the show. What are you going to be watching? I ask you this at the end of every interview. What's the next step that you think we should be aware of?
I think what we're worried about is the winter, not because of COVID alone, but because of the confluence of COVID and influenza. We don't have population immunity from last year's season because we didn't get it in the US pretty much. We may not have as much certainty about the vaccine for flu because that's why there are 4 types included in this vaccine as opposed to 3. So I would urge everyone to get their flu shot. You can get it at the same time as a COVID shot. And, wear your mask if you're worried about people around you, not just for COVID, but for influenza as well. And stay home if you're sick.
Yep. And we all know those symptoms. So we are definitely aware of them at this point in time with the pandemic heading into years now. So hopefully we can get everything under control and get back a full sense of normalcy, even though we're edging on it right now. Dr. Peter Chin Hong, thank you so much. I apologize again about the Giants not making it, but that's okay. Always next year.
There's always next year, exactly. But I'm still going to wear my orange. Thanks a lot, Daytona.
And Halloween right around the corner. You can't help it. Okay,
exactly.
Thank you so much. We will talk to you soon for sure. Have a great weekend.